Welcome and thank you for joining me. My name is Audrey Kutler and I'm a member of the New Hampshire ServiceLink Aging and Disability Resource Center team, also known as ServiceLink Resource Centers. It's May 2020 and we're sorry we can't be with you in person. We're in the middle of a pandemic and we're all staying home and wearing masks. The New Hampshire Department of Health and Human Services, with support from the Federal Administration on Community Living, the ACL, and Center for Medicare and Medicaid Services, CMS, established ServiceLink Resource Centers to provide unbiased, conflict-free, confidential information and decision support, including one-on-one assistance to individuals and their family members and/or caregivers at no cost to the individual or caregiver. ServiceLink staff are trained and certified as person-centered counselors and provide counseling and decision support related to long-term care options. As part of this work, ServiceLink staff are certified by CMS and New Hampshire DHHS as State Health Insurance Program counselors, SHIP counselors, so that they can provide effective and problem solve as necessary with regard to Medicare and Medicaid. There are 13 local offices in New Hampshire, with one here in Keene. ServiceLink ADRC offices are accessible and welcoming. I'll leave you with the phone number, a list of ServiceLink offices in the state, at the end of this presentation. Original Medicare A and B benefits have 3 enrollment periods: the initial enrollment period, the general enrollment period, and a special enrollment period. The initial enrollment period begins the 3 months before the month you turn 65, unless your date of birth is the first of the month. The month you turn 65 and 3 months after. This enrollment period is for when you are newly eligible to receive Medicare benefits, either by aging into these benefits, having ALS, end-stage renal disease, or being awarded these benefits by receiving SSDI benefits for 24 months. You will need to enroll into Medicare benefits at this time unless you have other creditable health insurance benefits, such as employer group health benefits from you or a spouse's current active employment. COBRA and VA benefits do not exempt you from having Medicare A and B benefits. Note that if you wait to apply for benefits until the month you turn 65 or the 3 months after to enroll, your Part B coverage will be delayed, which could cause a gap in coverage. If you currently have employer group health benefits through active employment, you can still opt to enroll into Medicare A and B benefits. Most likely your employer group health plan will be primary payer, or you can opt to defer enrollment into these benefits until you no longer have employer group health plan benefits. You will be given special enrollment rights at this time. If you are working and contributing to an HSA, you must stop contributing to this HSA at least 6 months prior. You may continue to use any HSA funds that you may have, but can no longer contribute to this account. Special enrollment periods. You will have special enrollment rights for certain qualifying life events. You can apply at any time for Medicare A and B benefits as long as you or a spouse is working and currently covered by a group health plan through you or your spouse's employer. You will have 8 months to sign up for Medicare A and/or B benefits that start at one of these times, whichever happens first. The month after employment ends, the month after group health insurance based on current employment ends. General enrollment period. You can sign up to enroll into Medicare A and/or B benefits at any time during this general enrollment period. This period runs from January 1st through March 31st of each year. This is for those beneficiaries who didn't sign up for Medicare when they were first eligible, and for those who weren't eligible for a special enrollment period. When enrolling for Medicare A and B benefits during this time, an application can be submitted at any time between January 1st and March 31st, but the benefits will not begin until July 1st of that year. You may have to pay a higher premium for late enrollment into these benefits. Medicare Part D plans. Part D plans are prescription drug plans that are for any medication prescribed to you that you administer to yourself. It can be a pill, a cream or ointment, drops you put in your eye or ear, injections such as insulin, inhalers, or transdermal patches. You are not required to have a Medicare Part D plan. If you do not enroll into a Part D plan when you are first eligible for Medicare, and you have no other prescription coverage, such as an employer group health plan, you will be limited to join a prescription drug plan to the annual open enrollment period, which is every fall, October 15th through December 7th. You will also have a late enrollment penalty. This late enrollment penalty is calculated by taking the number of months you could have had a Medicare Part D plan and didn't, times the late enrollment penalty amount, which is 35 cents in 2020. The late enrollment penalty is added to the monthly premium for the Part D plan you enroll in for the rest of your life. If you are coming from an employer group health plan, either your own or a spouse's, you will not have a late enrollment penalty. If you have VA coverage, you probably do not need a Medicare Part D plan. You can add a Part D plan on at any time, and you will not have a late enrollment penalty. There are 26 Part D plans in New Hampshire in 2020. The lowest monthly plan premium is $13.20. The highest monthly plan premium is $84.10. If you only use a few generic medications, your monthly plan premium would typically be below $50 per month. Unless you are very low income and qualify for assistance with your Medicare costs, all Medicare Part D plans have a coverage gap period in with the plan. You enter the coverage gap period of the plan in a calendar year if the total cost of your medications, what you pay at the pharmacy, and what the Plan D pays to the pharmacy reaches $4,020 in 2020. When you are in the coverage gap period, you will pay a 25% copayment of the full price of the medication. Most brand name medications will put you into the coverage gap during a calendar year. You come out of the coverage gap period each January. Some people who are taking very expensive medications may come out of the coverage gap period earlier in the calendar year and enter into a period called catastrophic coverage. You may look at your Part D prescription drug plan choice on the Medicare.gov website. You can also enroll into a Part D prescription drug plan through the Medicare.gov website. Now we'll talk about Medicare Advantage plans. Medicare Advantage plans, also known as Medicare Part C, are offered by Medicare-approved private insurance companies that must follow rules set by Medicare. You must have Medicare Part A and Medicare Part B, but all of your hospital and medical bills will go directly to the Medicare Advantage plan, not Original Medicare. These Medicare Advantage plans also have a monthly premium, but some can be as low as $0 per month. Most Medicare Advantage plans have a Medicare Part D plan included in the plan monthly premium. They may offer coverage for things that Medicare does not cover, such as dental coverage, which is typically very limited coverage, eyeglasses, hearing aids, and over-the-counter medications. The Medicare Advantage plans are often HMOs, which means you will have to use providers that participate in the plan's network. The plans typically have an out-of-pocket limit, which is usually between $6,000 and $7,000 per year. You will have limited copayment and coinsurance if your health and medical needs are low during a calendar year. If you have a major medical incident or chronic illness, you may have copayments and coinsurance that could reach several $1,000s in a calendar year. Every year during the Medicare annual open enrollment period, October 15th through December 7th, you can add, change, or drop a Medicare Advantage plan and return to original Medicare, Medicare A, Medicare B, and Medicare D. You may not be able to add supplemental insurance as you will probably be asked pre-existing condition questions. If you are interested in a Medicare Advantage plan, pay attention to the plan details. Ask to see the plan's summary of benefits. That explains all of your copayments, coinsurance, and what is covered. In 2019, about 1/3 of all Medicare beneficiaries were enrolled in a Medicare Advantage plan. Some retiree Medicare plans, such as retirees from Verizon and Eversource, PSNH, have seen their former employers switch their retiree Medicare coverage from supplemental insurance to a Medicare Advantage plan. When this happens, the coverage is typically very good coverage. The benefits of the retiree Medicare Advantage plan may have lower out-of-pocket costs than the Medicare Advantage plans offered to the general Medicare population. That is because the company, employer, the Medicare person retired from, has negotiated and customized the Medicare Advantage plan directly with the private insurance company. Now we'll move on to Medicare supplemental plans. Medicare supplemental plans work with original Medicare Part A and Part B. They can be called supplemental plans, Medigap plans, or Medicomp plans. Medicare pays first, then Medicare sends the remainder of the medical bill directly to the supplemental plan. You do not have to have a Medicare supplemental plan. No one can make you purchase one of these plans. There are many people who just have Medicare Part A and Part B. These people will be billed for the Medicare deductibles and coinsurance. If you don't sign up for a Medicare supplemental plan within the first 6 months your Medicare Part B is effective, and you try to sign up later, you will probably be asked pre-existing condition questions. You may be charged a higher monthly premium, or you can be denied coverage. There are 10 supplemental plans offered in New Hampshire and almost all other states. The most comprehensive supplemental plan is Plan F. This plan is now only available to people born prior to January 1st, 1955. The second most comprehensive supplemental plan is Supplemental Plan G. This plan does not cover the Medicare Part B outpatient medical annual deductible, which is $198 in 2020. The third most comprehensive supplemental plan is Supplemental Plan N. This plan also does not cover the Part B deductible. You will also have office visit copayments of up to $20 and a $50 copayment for the emergency room. Plans G and N have lower monthly premiums than Plan F. All F plans are exactly the same, no matter which company you purchase it from. All G plans are exactly the same, no matter which company you purchase from. The coverage gap is exactly the same. The only difference is the monthly premium amount. Once you sign up for supplemental insurance with an insurance company, it is very unusual for someone to change insurance companies. In New Hampshire, supplemental plans' monthly premium rates are based on your age. The monthly rates do increase as you age. Some large employers, for example, New Hampshire SAU, New Hampshire state employees, union members, and some organizations such as the National Education Association, NEA, and the American Legion offer supplemental insurance to their retirees and members. The monthly premium costs offered by these organizations are typically very competitive. Scams related to the coronavirus, also known as COVID-19, are rapidly increasing as the public health emergency develops. Scammers are targeting older adults and those with serious long-term health care conditions who appear to have a higher risk for serious illness from COVID-19. Fraudsters are attempting to bill Medicare for sham tests or treatments related to the coronavirus and are targeting individuals to illegally obtain money or Medicare numbers. There is currently no FDA-approved vaccine for COVID-19, and although there may be treatments for symptoms, there is no cure. However, scammers are often use fear-based tactics to convince people that a vaccine or cure is now being offered. It's also important to remember that although the Centers for Disease Control and Prevention, the CDC, and other public health officials may contact you if they believe you may have been exposed to the virus, they will not need to ask you for insurance or financial information. The Senior Medicare Patrol, the SMP, recommends that Medicare beneficiaries contact your own doctor if you are experiencing potential symptoms of COVID-19. Do not give out your Medicare number, Social Security number, or personal information in response to unsolicited calls, texts, emails, home visits, or booths at health fairs and other public venues. If your personal information is compromised, it may be used in other fraud schemes as well. Be suspicious of anyone going door to door to offer free coronavirus or COVID-19 testing, supplies, or treatments. Carefully review your Medicare summary notice or explanation of benefits, looking for errors or claims for products or services that weren't received. Follow the instructions of your state or local government for other actions you should be taking in response to COVID-19. Contact your local SMP for help. That's ServiceLink. SMPs empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. The Senior Medicare Patrol is ready to provide you with the information you need to protect yourself from Medicare fraud, errors, and abuse. Detect potential fraud, report your concerns. SMPs help educate and empower Medicare beneficiaries in the fight against healthcare fraud. Your SMP can help you with your questions, concerns, or complaints about potential fraud and abuse issues. It also provides information and educational presentations, such as this one. To locate your SMP, you can call 1-877-808-2468 or visit www.smpresource.org. You can also call ServiceLink. You might also be wondering what Medicare covers once you're on it if you get COVID-19. Part B covers COVID-19 testing and the associated provider visit. You pay no out-of-pocket costs. At this time, there's no vaccine for COVID-19. However, if one becomes available, the vaccine and administration of it will be covered without any cost sharing. Part A covers Medicare, will cover all medically necessary hospitalizations related to COVID-19. This includes if you're diagnosed with COVID and might otherwise have been discharged from the hospital after an inpatient stay, but instead you need to stay in the hospital under quarantine. Standard coverage rules and cost sharing apply. Medicare will also waive the 3-day prior hospital stay before admittance to a skilled nursing facility during the COVID-19 emergency. Part D, prescription drugs used to treat COVID-19 will be covered. If you have a Medicare Advantage plan, you have access to these same benefits. You've heard me mention ServiceLink throughout this presentation. That's because we are the state health insurance program. We have SHIP counselors, which are Medicare counselors, who can help you with all of your options. We can be reached at toll-free 1-866-634-9412, or there is a link to email us at our ServiceLink website, www.servicelink.nh.gov. Thank you for watching.